Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today, as promised, I'm going to make a video with all kinds of talking points to help to guide a patient and or parent who is on the fence about Invisalign versus braces to move in the direction of Invisalign. And if you're a consumer and you're listening to this, you're probably like, "Ooh, why is she doing this?" Listen, I've never worked for Align Technology Invisalign, nor would I ever work for them. I don't drink that Kool-Aid at all. However, a lot of times patients and parents come into an orthodontic office or a GP office where you're offering orthodontic services and they have an inherent bias. So I feel it's my job, in order to explain the risk, benefits, and alternatives, even if they're coming in with a preference. I'm going to explain the risk, benefits, and alternatives completely, and then you can make your choice. But 9 times out of 10, when a patient comes in, and we always like to ask initially when they come in, hey, what did you have in mind today? Did you have a preference of what you're looking for? Obviously, if they're coming in and their preference is Invisalign, boom, that's a go then, because almost never am I going to say no to an Invisalign case. First of all, you should always charge the same, so it's not a way to make more profit. But except for a few exceptions, which might be like an impacted second molar, I've actually managed to succeed now with impacted canines with Invisalign. It takes a little bit longer, but it's a way better patient experience. You can definitely be successful. You just have to think outside the box. So there's really nothing they can't do with Invisalign. I'm not going to say it's always be the fastest way, but sometimes it is faster. So if they're straight out asking me what's faster, most circumstances Invisalign will be faster. Just because you are changing aligners every 5 to 7 days. It's a slower, lower force. It's actually healthier for your teeth and gums. Definitely, there's tons of research. And if you want any of the research on this, just talk to your Invisalign territory manager, because they definitely have all the R&D on this, and they have great published studies that shows. This is a no-brainer, even as an orthodontist, having done a lot of Invisalign and having done a lot of braces. Okay, Invisalign is a zillion times better on teeth and gums. We have so much serious side effects with braces over the years, and I've seen so much damage done with brackets, poor hygiene, decay around the edges, moving too fast, root resorption, perio issues that come from the brackets, wires themselves, and or the movement being too fast and too strong. Remember, traditional braces, you're usually coming into an office every 5 to 10 weeks, having a tightening done, which is a very high force, which then dissipates, degrades, and goes down slowly over time. So that force is really undulating. So it's peaking and then it's going down, and it's peaking and it's going down. And that's why if you've ever had traditional braces, the extreme discomfort you're gonna have 1, 2, 3, 4, 5 days after your tightening visit. I remember having had braces more than once, especially being at high school having braces. I remember that next day after your orthodontic adjustment, you were going to be in extreme discomfort at school. Not only having new things on, rubbing against your gums and your teeth, cutting open your lips, bleeding, infections, mouth sores, that kind of discomfort. But also just the achiness, because it's such a high force when they come in and they do that adjustment, because you're not changing that aligner at home every 5 to 7 days, which keeps it's still the same amount, if not faster movement. It's so much more incremental and gradual that it doesn't hurt like that. Nor does it cut open your mouth and bust it all up and cause mouth sores. So, I remember being on basically liquid diets. It was not abnormal after you got your braces on to easily lose 10 to 15 pounds. Of course, once you get comfortable, you're eating again and you're putting on the weight. But very, very normal to lose a ton of weight. Matter of fact, people would sometimes ask for braces in order to lose weight. It was like a weight loss tool, because it's so uncomfortable, you can't eat. So, that just sounds like, why put yourself through torture when you don't have to? So, of course, with aligners, you can still be sore as you change aligners, but that usually means that treatment plan is too aggressive. If you're feeling any more than just like a twinge for an hour or two, your treatment plan is probably a bit too aggressive. And whenever I work on treatment plans, I tend to slow them way down, do more frequent aligner changes, and have smaller incremental steps, because it's healthier for the bones and the teeth than doing a big step every 2 weeks. That's just how I operate. I have seen, oh my goodness, between my own private patients I've seen in different companies I've worked for, as well as now working with StraightSmile Solutions and supervising a lot of, I'm not saying supervising, but having a high level view of a lot of progress patients from a lot of doctors who work with me or hire me. I have yet to ever see damage to roots, gums, or teeth with Invisalign. And as far as I know, Align Technology does say they don't know of a single root resorption case in Invisalign, or at least severe. I mean, root resorption can be iatrogenic. It could be caused due to an inflammatory or autoimmune, situation. It could be caused by an infection that's not related to Invisalign. It could be, concurrently happening at the same time that you had Invisalign. So you can't necessarily pinpoint that on the Invisalign. But the frequency of damage that I would see in braces patients was significantly higher than anything I've ever seen in Invisalign. And since Invisalign's been out for 20 years, I feel very confident saying that. And I know that the team in Align Technology says the same thing. So going back to the original discussion, how can you convince a parent or teen? The first thing I say is, let's talk about your life. Let's talk about, definitely we could do braces, we could do aligners. Let's talk about what's that life like in your life. I want to know a little bit more about you, what you do, what's your average day like, what do you do after school, what do you do on the weekends? That's how I always start that conversation. If they haven't fully made up their mind, and even if they have and they're saying braces, I'm still going to have this conversation, because again, you have to give all the risk, benefits, and alternatives of the options, whether they come in with a decision made or not. And that's part of it. So I like to hear about their day, They say, hey, I go to school. I say, oh, what's your favorite subject? What do you think about doing in the future? I always like to know, are they a good student? Is school their thing? Are they thinking about college? Are they thinking about vocational school? What do they do after school? Do they do music? Do they do sports? Do they make their practice? If they do sports, do they make their practices on time? I'm going to get to what I'm getting at here. If they do music, are they doing this, lessons? Are they in an orchestra? How are they doing? Do they practice? All these kind of little things I'm working up to. I'd like to know, okay, are you an academic person? Is school something you enjoy? So from there, I'm learning a little bit more, are you in scouts, about the patient, letting me know if they're going to be a compliant individual or a non-compliant individual. Obviously, even just walking in, if they're walking in looking disheveled, they don't wash their hair, they don't brush their teeth, they don't look happy to be there, to be really honest, I don't want to treat them at all. Because even if mom's coming in saying, Johnny needs braces, Johnny looks like all he does is game, smoke weed, sorry to, guess these things, but I mean, hey, I'm from California. This is kind of normal. He's not washing his hair. He's not brushing his teeth. Well, I'm going to say, you know what, Mrs. So-and-so, I'm a little concerned. Doesn't look like Johnny's taking care of his teeth. Doesn't seem like it's a priority in his life right now. I don't know if I really think orthodontics is a great time for him to do it right now. It's a good time for him. Sure, we could install braces on him, but my concern is he's not going to take care of them. We're going to have frequent breakage. It's going to be frustrating for me. It's going to be frustrating for you. If he's not taking care of his teeth and gums, we're going to have decay around the teeth. We're going to have damage to the teeth and gums. Why don't we wait for a time when Johnny's really ready for this? And then sure, she might drag her kid to some other orthodontist, but that's fine. She can. Because sometimes the patient isn't happy to be there because mom says you're getting braces and they want aligners. So this is where, I'm going to ask questions, like I said. And if they tell me that, that they're doing things that show me that they might be a responsible patient, I'm going to say, yeah, we could be an Invisalign patient or we could be a traditional braces patient. Let me break it down, the pros and cons in little Johnny's situation. And of course, I go over the discomfort and the medical reasons for aligners versus braces, the medical benefits. Then I can go over treatment time in terms of would it be faster in one or the other. And sometimes braces will be faster and sometimes Invisalign will be faster. But either way, it's an option. We break that down, we talk about the experience, and then I like to relate the experience to what the patient does. So if patient tells me he plays, for example, football, basketball, some type of water polo, some type of more high impact sport, of course they need to be an Invisalign patient. Matter of fact, I might even decline doing braces on them. I want to say, you know what, even though it costs me more, I have more overhead doing, it does cost me more. I'm not saying anything correct because around the front end, it does cost me more. I purposely, unlike some other orthodontists, I purposely keep my prices the same because I want patients like little Johnny here to be able to afford, if price is an issue, and make the right decision for them. I don't want them making a decision based on price. I want them to be able to pick what's healthiest and best for them. So for this situation, I think that Invisalign would be a superior choice to traditional braces because little Johnny is so active in sports. The chance of him getting hit in the face, elbowed in the face, and having breakage or even severe damage to his lips, gums, and teeth from having metal braces installed is high. You know, I think it's a healthier choice to be able to have a removable appliance. And, you know, a lot of times mom will push back and say, well, I don't think he's going to wear them. And I'm going to say, well, you know, little Johnny, you know, tell me a little bit about your water polo. You know, do you show up for practice on time? Yes. Does your coach play you? Did they say that you're being responsible? Yes. Do you follow the rules? Yes. Okay. Do you think that, obviously, ultimately, it's mom's choice, you know, but I do believe that you're telling me that you're a responsible individual, and I trust that if we did Invisalign, that you would be responsible and leave them in your mouth. And they usually say, I said, would you be willing to do that? You know, ultimately, again, it's mom's decision. And a lot of times they go, yeah, I'd much rather have that. And you see their eyes light up. And you know, I can always tweak a treatment plan to slow it down if they're not being super compliant, and it's still going to work. There's a lot of different ways I do it. Or we can actually speed it up and do what I call leave-in plan. So there's no reason for the parent to say no, because there's all different workarounds. If they're saying they're going to lose it at lunch, I say, okay, we'll tell you what, let's do this. Let's see how it goes. Usually this is not a problem. You know, do you wear pants with pockets? Yes. Well, here's how the case is. Let's try this case in your pocket and see if it fits. And they're super streamlined. Can you drop this in your pocket? Yes. Can you put this in your backpack? Can you tell me, little Johnny, how this is going to work at lunchtime at school? Tell me how this is going to work. Do you have any friends that have Invisalign? Oh, yeah. What do they do? Yeah, they just pop them out and put it in the case, put it in their pocket. Yeah, it's really not that hard. I have 6 and 5-year-olds that do this, Mrs. So-and-so. You know, it's really not a problem. And we even offer up to 3 lost aligners with the treatment. It's, you know, I mean, Invisalign doesn't offer anymore with teen, I don't think, lost aligners, but they're only like $10 each. So, I mean, just like, you know, you'd have a few broken brackets that you'd include, you know, you just tell mom we're going to include up to X amount of lost aligners. After that, they're only $10 if you lose them. But, you know, we can definitely waive the first few. I'm really not concerned. And, you know, another thing we can do, if somehow he's really having issues losing it at lunch, if that's happening, you know, there's all kinds of cases that can be clipped on backpacks and clipped on pockets, but we can always modify the treatment plan so that little Johnny can wear the aligners all day and not take them out at lunch. And you can do that. You actually speed up a treatment plan. They don't take them out. They eat with them in, which actually makes treatment go faster. So you can speed it up, and they're going to change the aligners twice a week. Or, you know, every 4 days. Yes, it gets nasty. Yes, when they come home, they need to brush, floss really well, super scrub the aligners because they're going to be disgusting. But they're throwing away a pair, getting a new pair twice a week. It's really not that hard. And most of the time this works really, really well. We do this with little kids all the time. The little kids, we just tell mom, patient never ever takes them out. As soon as he or she gets home from school, time for dinner, you're going to take them out of their mouth. You're going to brush and floss the appliances. After he eats, you're going to brush and floss his teeth, and you're going to check for plaque, and then they go back in and there's no more snacking, and the cycle repeats tomorrow. And you just make sure they're using a lot of fluoride and they're not drinking any sugar sodas or eating any candies with them in, but that works out just fine. So in any case, I know this was a long lecture today, but hopefully gave you some good talking points to be a little bit more enabled to be able to explain the why for removables over fixed braces in a practice. Thank you.